Hi, hello. Happy Thursday. I'm Parijat Deshpande, and I wanted to come on here today to talk to you about trust. It's something that's been on my mind for a little bit. I think it's going to resonate with a lot of you who are going through fertility treatment, infertility, loss, high-risk pregnancy, bed rest, even if you have babies in the NICU. I think this is something that's just been on my mind for a little while. I've wanted to talk to you about trust, right? It's hard to trust when things are falling apart around you. I mean, it's one thing to have faith that everything's going to be okay, and it's one thing to hear from people around you, everything's going to be okay. But that trust deep inside, where you just know that you're going to be okay, that it's going to be okay, that you're going to come out of it on the other side the best way possible, even if you're broken, even if your heart's broken, even if it's not the picture that you wanted it to be. And so there's three aspects of trust that I wanted to talk to you about, because I know from my personal experience of going through infertility, a high-risk pregnancy, prematurity, and then caring for a child with medical complications, trust is hard to have. And there's a lot of pressure to have that trust, right? Just trust everything will be okay. Just be positive. And that'd be great if it was that easy to do, but it's not. Because if it was that easy, you would have done it already. I know that. You don't like questioning everything. You don't like doubting everything. You don't like the idea of feeling like people are withholding information, or that you don't know what to do, or that you don't have a positive outlook. I know you don't like that. I didn't like that. When you're going through a medical crisis, like infertility, like loss, like a high-risk pregnancy, like having a baby in the NICU who's fighting for their life, it can shake your trust. And I want to make sure that you are putting your trust in the right place, because it can make or break your experience and the treatment and the support that you receive. So there's three different categories of trust that I want to review with you to make sure that you are putting your trust in the right place, because I know it's hard. I know you don't have a lot of it, and that's okay. I want you to make sure you're not judging yourself for that. And that's why we're talking about it, so that we can get you on the path to having that trust. And there's three types of trust here. Trust in the team that's around you. Do you trust them? You know, when it comes to doctors, that's one aspect of your team, right? We have a tendency to hold on to our doctors because we love them, right? Some of us have amazing doctors who we absolutely love. I was actually just having a conversation with somebody about this recently, about how she sometimes has to coach people on how to break away from their doctor if they're not getting the results that they want with their health. And it's a hard conversation to have, because I know I do. Like, my doctors became my friends because we went through so much together. But just because they're nice, just because they're loving, just because they care about you, that doesn't necessarily mean you inherently trust them. So it's a question that I want you to ask yourself. Do I deeply and truly trust my medical team? And it's okay if you say no. It's okay. It's actually better that you say no than you go on believing that you do have trust in them, when in fact there's all this doubt in the back of your head going, are they doing the right thing? Are they hiding something from me? I'll tell you honestly, I had the best medical team during my high-risk pregnancy. I say this all the time. If I ever had to do this again, I would hire each and every one of them all over again, because I just really loved them and I really did trust them. But there was a time about halfway through my pregnancy, which means right around the end of the first trimester, where I had a moment where I think I had developed 3 or 4 complications at that point. And I was on bed rest at home. And I had this moment where I was like, Is my doctor hiding something from me? Is there something she knows that she's not telling me on purpose, which just fueled this desire to keep Googling, right? Because there was this doubt that came up going, is she right? Is she telling me everything? Is she hiding something from me? Can I trust her? It happened. And this is a doctor who I absolutely love and that I'm friends with, and that, I put my whole heart, my whole life, and my baby's life in her hands. But there are moments when I didn't trust her. And I know that there are several of you who are watching who have that feeling about your medical team more frequently than just once in a while. So really ask yourself, do I trust my medical team? And if not, why are you still with them? It's time to move on. It is time to move on. Okay? And it's not just your medical team. We're talking about trusting the people around you. That includes your partner. That includes any other support systems that you have. That includes your employer, right? Do you trust them to have your back if you're going to need time off for appointments, for being on bed rest, for having a baby in the hospital? Do you trust them to be able to do that? What you do about it comes later, right? You've got to have this conversation with yourself first. Do I trust them? Because we're so used to just getting through life on autopilot. We just go and we assume, okay, we've got these people in place, we've got those people in place. It's just our routine, and we don't stop and think about it. And when it's your life, your health, and your baby's health that's on the line, now is not the time to be on autopilot. So you've got to ask yourself these questions, right? So the first aspect of trust that you want to consider is the team that's around you. Your medical team, your partner, your family, your friends, your employer. Do you trust them? Do you trust them to have your back? Do you trust them to support you? Do you trust them to do the best that they possibly can? You've got to ask yourself that question first. The second aspect of trust is, do you trust the process? This is a hard one. This is a really hard one. I had a lot of trouble with this because with infertility, with a high-risk pregnancy, with having a baby in the NICU, that entire step of the way, there's so much uncertainty. There's so much just wait and see. There's so much just adjusting and tweaking as you go, which is hard for this planner obsessive person, right? Which I know can resonate with a lot of you. All of my clients that I work with are like me, type A planner. I need a plan. And then you go into the situation and there's no plan. Do you trust the process? That sometimes waiting is the best option? Do you trust the process that taking it one day at a time is the best thing and the only thing you can do sometimes? And do you trust the process that waiting does not mean sitting on your hands and doing nothing, but that it means it's time to throw everything at it, meaning medical treatment as well as changes that you can make to help yourself have a healthier pregnancy, have a healthier body to get pregnant, to be able to help your child? Do you trust that process? I'll be really transparent with you. Most of my clients don't. I didn't. We have no trust in that process because there's no immediate reward. There's no immediate result. There's no immediate response or immediate effect to show us it's working, right? Hey, Erin, I'm so glad you're here. Let me know what questions you have or what comes up as you're listening, okay? We have a hard time. A lot of us have a hard time trusting the process when there isn't a 2 + 2 = 4 situation. I ate well today. I slept well today. My contraction should be gone tomorrow. It doesn't work like that, right? We want it to. We so want it to. It's a long game. Infertility, high-risk pregnancy, time in the NICU. You're in it for the long run. It's a long game. Do you trust that process? And if not, that's okay. There's no judgment here, but you've got to admit that to yourself first. Accept that, because that is the only way you're going to know what changes you need to make. Is it a change to the team? Is it a change to the support that you're around? Is it a change to what you're doing? Is it a change to who you get advice from? That's where that becomes much clearer. So trust in the team that's surrounding you, which includes your doctors, your partners, your friends, your family, your employer. Trust in the process. Do you trust that waiting and seeing, taking time, taking it day by day, and that you can influence the process? Do you trust that? And the third aspect of trust, do you trust yourself? Do you trust yourself? Do you trust yourself to make decisions that are good for you and your baby? Do you trust yourself to know who to ask for support from when you don't know what to do? Do you trust yourself to be able to filter out information that works for you and that doesn't work for you? Do you trust yourself to stand up for yourself and for your baby? This one's huge. Because if you don't have that trust in yourself, that's when we start to feel like we're completely lost at sea with the waves crashing over us. There's no buoy, there's no land in sight, and that overwhelm becomes really, really strong. And what happens when that overwhelm becomes strong? We feel so helpless. And we start feeling like there's no chance that things are going to get better. We start to feel like there's nothing we can do for our pregnancy or our bodies to get pregnant or our babies to help them survive. And that is breeding ground for depression. Pure and simple. So it starts with you. Do you trust yourself? Do you trust yourself to know who to reach out to? I'll tell you, I'd say 80 to 85% of the clients that I work with, they come to me, usually they're second-time high-risk moms. So they've gone through it before. They've either delivered preterm before. They've either had a high-risk pregnancy before. Something's happened. They've had birth trauma before. They've gone through it before, and this is the second time around. They're going, don't want to do this again. And I will tell you, 80 to 85% of them had trusted somebody else first. And why did they trust somebody else first? That includes maybe a doula, that includes a midwife, that includes a therapist. Somebody else was on their team. And why did they bring them on their team? Because they didn't trust themselves. They trusted other people. Other people said, hey, this person's great. And they didn't think about, are they going to be great for me? They took the advice, which we all do. We all do it, right? They took the advice of their friends, their relatives, their doctors, whoever. They said, okay, great. I'm not going to do the research because I trust you, so I'm going to trust this person. And they didn't help. And then they come to me the second time around. They go, I don't want to do that again. And then they put their trust in me. And the only reason that they do that is because now they're listening to what they need. I don't want anybody to put their trust in me if it doesn't feel right to you. And I don't want you to put your trust in anyone else unless it feels right to you. You've got to be behind this. You've got to feel that trust in yourself. You've got to believe, I know what I'm doing. I know this person's right for me. I know this resource is right for me. I know this decision's right for me. And then get the advice and the professional expertise that you need, absolutely. But it starts with you. You've got to trust yourself. And it is freaking hard to do. I will put that out there right away. It is hard to do. Erin says, advanced maternal age pregnancy, I trusted myself, but changed hospitals and physicians. Nothing went according to the birth plan. Prom induced 7 days in the hospital. Baby's 100% healthy. This is resonating. I'm so glad this is resonating. Yes. And okay, I just got to stop here and say, thank you. Good job. I'm proud of you for trusting yourself because that makes the most difference. I have a friend who shares that's a similar story too. She trusted herself to know her team was not right for her babies in the NICU. She knew her medical team, her OBs weren't right for her towards the end of her pregnancy when she knew she was going to deliver preterm. And she went, you know what? I know I'm at the end of my pregnancy. You're not going to be delivering my baby because I trust myself to know who's the right person to help me and my babies, and you're not it. I mean, do you hear the power in that? Erin, I know you experienced it, so you can probably speak to this too. There's so much power. There's so much power. All of a sudden, this big, huge medical crisis like infertility, like having pregnancy complications, like having a baby in the NICU, all of a sudden that feels manageable again. Can you fix the whole thing? No, nobody can. Not even your doctors can. Not even a Harvard-trained physician can. But what you can do is direct the way that this is going. You can change the experience for you and your future children. That has immense power. And that not only gives you access to incredible medical care that you may not be getting, even if your medical team is amazing, but it protects you from so many complications postpartum. So much I can't even tell you. So we're talking about trust today. We're talking about trust because it's a foundational piece of what needs to be in place when you're going through health crises like infertility, a high-risk pregnancy, baby in the NICU, or something else. You've got to trust the people around you, your doctors, your partner, your friends, your family, your employer. You've got to trust the process, that sometimes you've got to wait and see. Sometimes there's a lot of uncertainty, and as much as it sucks to have to accept that, it's there. And that the process can be influenced by things and decisions and choices that you make. And you've got to trust yourself to make the right decisions, to know who to ask for help from, to reach out when you need that help, to believe that your body is speaking to you and that you know when to speak up when something feels wrong. It's such a game changer. Such a game changer. And so if there's anything you take away from today's video, it is this. Ask yourself if you have trust at all three levels. No judgment at all. It is okay if you don't trust. I have not trusted along the way in each of these categories. I get it. It's hard. But you've got to start with asking yourself, do I trust myself? Do I trust my team? Do I trust the process? And then if the answer is no, then you can figure out what you need to be able to build that trust. Because without trust, you're just going to feel like you're being pulled behind a speeding car on a ditch-filled road. That is not how you want to go through your pregnancy. That is not how you want to feel at any point in your life, because that freaking sucks. And it has long-term consequences on your emotional health and your physical health. I want you in the driver's seat of that car, and you can get there. Take it one day, one step at a time. You really can do this. I believe in you. Take care.